So in my introduction, I talked a bit about the origins of this interfaith pre-conference, and that its inception was a result of my engagement and Reverend Mike's engagement internationally around faith and HIV. Our next speaker is someone who has been connected to that movement since the very beginning. And while this is a national conference, we are informed by a much larger global pandemic that is before us and understand that they are connected. And so we always like to give you an overview of the landscape of HIV globally. And given our theme, we want to particularly focus on the global faith response to HIV in women and girls. And so please join me in welcoming Francesca Merico, who will give us that update. Jessica.
Thank you. I see that a lot of people have left the room, and I don't take it personally. I know. I also, I'm going to say that I'm never going to forgive Ulysses and Mike for having put me after Dr. Reverend Sandy and Mrs. Deborah and Rachel, because I'm not going to present and I'm not going to talk the same way. I'm going to present boring data and numbers, but the reason behind all the numbers and the targets that I'm going to refer to, which is without the data and the targets, we cannot scream, as Louise was saying before, and encourage others to make a change. And so I'm going to just start sharing. Just a bit about me. My name is Francesca Merico. I live in Switzerland. I'm Italian by origin. I am a lawyer, a passionate human rights and children's rights advocate, and Rachel is singing. And I have the pleasure to work for the UNAIDS PEPFAR Faith Initiative and the PEPFAR Faith and Community Initiative. So I was very pleased about the title of the conference, Contemplating Faith, Celebrating the Divine Feminine and Combating HIV Stigma. And when I first saw it, I said, what does it mean exactly? What is divine feminine that we're going to celebrate? And what people are going to talk about? And what I appreciate is that it made me reflect a lot about our work, how and what the divine feminine means to me in my life, and also with reference to the work that I do. So I have also a short, brief reflection at the very end of the presentation that I would like to share with you. And what I'm going to present is, first of all, some data about women and girls worldwide. The second part is going to be around policies, targets, and numbers that have been set and adopted by UN member states. I'm not moving it on purpose. I'm going to present the policies and the targets that our governments around the world have adopted, and we need to make sure to hold them accountable. And then I'm going to present a bit briefly about some of the activities of the UNAIDS PEPFAR Faith Initiative and the PEPFAR Faith and Community Initiative, where I think I would love to collaborate more with all of you, but also where there is a great potential to focus more on women and girls. Okay, so I'm going to start with the numbers. And these are data from the latest UNAIDS report that was issued in July 2023. So globally, 46% of all new infections are among women and girls worldwide. And in sub-Saharan Africa, women and girls account for 63% of all the new HIV infection. And every week we have 4,000 adolescent girls and young women aged between 15 to 24 who become infected with HIV globally, and 3,100 of these infections are in sub-Saharan Africa. And here is a lot of information on one slide, but I think it's all very relevant information. It says that we are not doing good, and we are not doing enough for young women and girls. So in sub-Saharan Africa, there are 3 in 4 new HIV infections among 15 to 19 years old are among girls. And then AIDS-related illnesses remain the leading cause of death among 15 to 49 years old globally. And HIV incidence is 10 times higher among female sex workers than among the general population. We also know that in sub-Saharan Africa, 42% of women living in urban areas had the pregnancy before the age of 18, while in rural areas is more than 50% of women the same age, which means that 52% of adolescent girls and young women are unable to make decisions about their own health, compared with 47% in urban areas. And then we have 42% of urban young women who live in sub-Saharan Africa who had sex and they had an HIV test, but 30% only in rural areas. And what's also, it's important to know that each year, 12 million girls are married is completely the wrong verb. Before the age of 18, it shouldn't be considered a marriage. And this put them in a high risk of HIV infection. And around the world, 150 adolescents died of AIDS-related illnesses every day. This is data from 2016, though. Okay, as I was telling you, I wanted to present a bit about the policies that our governments have adopted. And for which is very important that we speak louder and we make sure that they do what they promised they would have done. So these documents, starting from the top left, is the political declaration on ending AIDS, ending inequalities and getting on track to end AIDS by 2030, which was adopted in 2021. And there's going to be an important revision in 2024. And the United States is also part of the countries that has adopted such as political declaration. Another important document is the Global AIDS Strategy 2021-2026, again, with a strong focus on ending inequalities to end AIDS. Then we have the PEPFAR 5-year strategy, which was launched in December 2022. And I put also a document which is a spotlight on HIV-related stigma and discrimination, specifically against women and girls. And all these documents, I can share them with you if you are interested, of course. So going into some more of the details, the strategy, the Global AIDS strategies prioritize has 3 key priorities. One is maximize equitable and equal access to HIV services and solutions. The second one is we must break down barriers to achieve HIV outcomes. And the third one is around the resources and sustain that must be sufficient and efficient. And also that there is a strong focus on integration of HIV with other diseases. And underneath there, we see what are the focus areas of the commitments and the targets in the political declaration. So first of all, we need to ensure stronger access to combination prevention to all. We have the 95, 95, 95 testing and treatment targets. And we are committed to end pediatric AIDS and eliminate vertical transmission. And these commitments are for 2025. We have then an important focus on addressing gender equality and in promoting gender equality and empowering young women and girls. We talk about community leadership, including the leadership of women, realize human rights and eliminate stigma and discrimination. Then we have universal health coverage, integration, and investments and resources. So here is a slide with a lot of numbers again, but what I think is important about the targets set by all countries for 2025 is that we have also specific targets that are looking at the social determinants for health, the 10-10-10% targets. And the commitment is that less than 10% of countries have punitive law and policies, less than 10% experience stigma and discrimination, less than 10% experience gender inequality and violence. These slides show the detailed targets for combination prevention and HIV testing and treatment. And again, I wanted to draw your attention on the target for women. For instance, reduce the number of new HIV infection among adolescent girls and young women to below 50,000 by 2025. But there is also an important target around ensuring availability of PrEP to at least 10 million people. And we are really far from that. Again, here are other numbers, and I'm sorry if I'm boring, but the targets are for specifically for women, pregnant women, breastfeeding women, but also women in general of reproductive age. And here we have a 95% of women have their HIV prevention and sexual and reproductive health services needs met by 2025. And then 95% of pregnant women are tested for HIV and other diseases by 2025. Again, 90% of women living with HIV must be on antiretroviral therapy before their current pregnancy. And all pregnant women living with HIV must be diagnosed and on antiretroviral therapy by 2025, and 95% achieve viral load suppression. So I keep repeating by 2025 because it's really just around the corner. And I think we have a very important role as members of faith communities to make sure that actually these targets are reached. It's really very important because these numbers are not just numbers. They mean that lives are saved and people's life, and that we can contribute to better life for many people around the world. Again, I'm going to leave these details, but I wanted to make sure that everyone here knows these numbers and these targets so that we can put in place advocacy activities and campaigns that can really bring about change in the life of many people. Okay. Here is a slide that tells us again that we are not doing much very well. So we see that in sub-Saharan Africa, 7 in 10 young women do not have comprehensive knowledge about HIV. And before we were talking about the importance of sharing information and making sure that empower young women and girls in our communities so that they can take the decision for their life. In 2019, adolescents younger than 18 years needed explicit parental consent in 105 of 132 countries in order to take an HIV test. And in 86 of 138 reporting countries, they needed such consent to access HIV treatment and care. Sex work is criminalized and punished in at least 88 countries. And transgender people are criminalized and prosecuted in 19 countries. Same-sex sexual relations are criminalized in 66 countries and are punishable by that in at least 10 countries. Laws criminalizing HIV transmission, non-disclosure or exposure exist in 82 of 119 reporting countries. And 6 countries reported that vertical transmission of HIV remains a criminal offense. 13 countries report that they have laws, regulation, or policies in place on mandatory HIV testing for marriage. And again, in 2019, only 45 of 106 reporting countries and needle exchange program. And then another striking figure is about there were 2.57 million people living with HIV affected by humanitarian emergencies globally in 2016. At least half of them were women, and the number is increased now. Ulysses asked me to talk about the global faith response to HIV in women and girls. And actually, I need to say that we are not doing very well at global level in our engagement, specifically on women and girls. And I'm really grateful for the opportunity today because it gave me a lot of ideas about how we could do better, but we are not doing good. So the PEPFAR UNAIDS Faith Initiative was launched in 2015. And it has 6 key priority areas of focus. The first one is documenting the contribution of faith. Around the world, a lot of people say that faith-based organizations are doing a great job and they are key contributor and partners to the AIDS response. But there are also a lot of people within the UN and other organizations that say that faith-based intervention are not intervention. And they are not intervention because there are no data and there is not enough information about their and the contribution. So what the initiative is doing is making sure that we can collect information and gather information to prove that FBOs are actually contributing to the to the response to HIV. The second area is around sustaining and strengthening FBO's response to pediatric and adolescent HIV. And here we have been doing a lot of work together with the Vatican, other faith-based organizations, but also pharmaceutical companies and other organizations to make sure that specific commitments were adopted to accelerate the research, the development, introduction, and uptake of specific and optimal testing and treatment for children. Another important area of work is around building the capacity of local, regional, and national FBOs with religious communities to offer compassionate and evidence-based HIV services. And again, this links to the documentation piece, and it links to creating spaces at international and global level where people of faith can come together. For instance, the International AIDS Conference or the AIDS Conference in Africa, ICASA, etc., where we can bring representatives of various faith groups so that they can share their experience, they can share the work experience like the one that I've heard today would be excellent, and we can learn from each other. So again, we create a space for networking and sharing and capacity building. The third area of work is around challenging gender inequalities and sexual and gender-based violence. Here, a lot of work is done specifically in country. For instance, our implementing partners, such as the African Christian Health Association platform, is working now in Zambia with local organization to set up and to put forward a strategy for a religious institution and faith-based organization on addressing sexual and gender-based violence. But a lot of work is done also around awareness raising and mobilization of faith leaders on sexual and gender-based violence. And we work, for instance, also with Islamic Relief, particularly in Kenya, on this. Another area is around reducing stigma by articulating a model of justice and inclusion through religious structures and offering services to marginalized communities. We have a tool that is the frame of a dialogue between religious leaders and network of people living with HIV, which brings together members of key population groups and religious leaders, and they work together to identify activities that can help addressing stigma and discrimination. So, for instance, we have now faith champions against homophobia in Malawi, or we have a manual based on scripture in Ethiopia that helps addressing sexual violence and abuse against children. So different outcomes in the different countries. And then we work on advocacy. So we bring together different faith groups and we work together to advocate for strong, sustaining HIV programs at local, national, and global level. And I can tell you it's quite difficult at times to bring together groups of faith from different traditions and with different doctrines. But our starting point is always what we have in common. And we make sure that we work together in the respect and dignity of everyone. So the UNAIDS PEPFAR Faith Initiative has a website. And we use this website as an opportunity to bring together people, again, of different faith. We have currently 2,700 members from all around the world, primarily Christians, but there are also Muslim, Jewish, Hindu, and other groups from other churches around the world. The website is interfaithhealthplatform.org, and there you can find resources from the different groups and we engage with. We have also joint advocacy activities, and we have stories, we have materials that are developed by different faith groups. So my first request here today would be, if you have material that you would be happy to share with other partners, faith-based organizations around the world, please let me know. I'll be happy to share this on the website. I think it's always a very important opportunity to for others to know what you are doing. Here, I just wanted to talk a bit about our 10 million campaign, which is a campaign meant to create interest around HIV around the world. And it's also a campaign that is meant to engage faith leaders around the world to talk about HIV in their faith communities. So the 10 million campaign, which before was called 13 million and then became 12 million, and then now it's 10 million, takes the name from the number of people who are living with HIV, but they are not aware of their status and they have no access to HIV services. So it is for making sure that everyone, so children, women, and men, have access to healthy lives. So the information on the campaigns are on the website, but what I wanted to make sure is just to share with you the three pieces, the key pieces of the campaign. One is we have put together with all the different faith-based organizations we are working with, so it's 2,700, as I said, a promise to action, a commitment to action, where they commit to engage at least 10 members of their faith community and networks to in the campaign. And this means that each person that signed the campaign has this responsibility to inform others about HIV, to talk about the latest prevention tools, to talk about the importance and value of testing and treatment. And it has this a domino effect. So we have this, and then we are engaging and working with faith HIV champions. I think that what I would really like to do is clone Dr. Reverend Sandy. We would like to have all around the world people like her, and I think Ulysses and Reverend Mike, that it would be great if she could come at the AIDS conference next year and share her experience there and the work there. And so we want to create sort of Reverend Dr. Sandy models for their faith communities. And then again, is mobilize action, is making sure that we capture, again, and we document what the different faith leaders and the different groups are doing to spread information about HIV, to spread information about the tools that exist, and encourage people to get tested, and if HIV positive, to remain on treatment, and also to accompany them. So my second request is please sign the campaign. There is a paper to fill on the website, and we hope that then each one of you can identify 10 other people and encourage them to be part of this campaign and share information again about HIV. Here is another activity. So what we believe is really important is to make sure that young girls are empowered and they are knowledgeable about HIV. And so here is a work of the PEPFAR UNAIDS Faith Initiative with young girls and boys as well in Kenya. It's in collaboration with the World Council of Churches and the Network of Religious Leaders Living with HIV. And we worked with 13 religious congregations and schools in Nairobi County. So we worked with the school. Again, we went into the school to make sure that the children received the appropriate information about HIV. And then we asked the children to become advocates for their peers. And here is some photos from a march that we organized both on the 16th of June, which is the Day of the African Child, and the 20th of November, which is Universal Children's Day, where Chill called for a greater access to treatment and testing for their peers. But I also got engaged in a children letter writing action, where they wrote letters about what they know about HIV And they wrote to ministries of health and finance. They wrote to pharmaceutical companies, and they wrote to their religious leaders, asking to make sure that HIV is taught and information is shared in the school, but also in the places of worship. And again, they became advocates for better tools and medicines for other children living with HIV. And these resources are available for everyone, and they can be used in different places. Here I have images from the Children Letter Writing Action in South Africa, but again, we had schools and groups all around the world. This is something I've been talking a lot in the past, I think already. It's the Interfaith campaign, Leading by Example, religious leaders and HIV testing. We have been working with, again, religious leaders, about 3,300. Again, from different faith traditions all around the world, and they became champions and to encourage HIV testing in their faith communities, showing that they can also get tested for HIV. Here I have images of some of the women involved, but I think more can be done in terms of engaging either women, including young female religious leaders. This is about the other faith initiatives, is the PEPFAR Faith and Community Initiative, which was launched in 2018. The specific focus is to ensure case identification and access to treatment for men and children. But here, women play a specific role as those that are educated and informed about HIV so that they can support their children and their partners or male members of their family to get access to the information and encourage them and accompany them to get tested and be on treatment if positive. So with the PEPFAR Faith and Community Initiative, we have been working on identified messages of hope about HIV. What Mrs. Deborah was saying before is, when I found out that I was HIV positive, all the messages were very negative. You're going to die. So there was no hope offered. And unfortunately, this information seems to be still relevant in many parts of the world. So with this work, we have been trying to share messages that actually reflect the reality of the situation now. We have tools, and it's important that these tools are used. And we did this combining a very simple language around HIV into sermons, prayers, Advent calendars, or other religious resources that were used in faith communities. We worked with a lot of faith leaders, especially in Sub-Saharan Africa. And again, we have a lot of materials, including a guide for religious leaders. We have WhatsApp and Instagram messages around HIV. We have videos. We have podcasts by young people in faith communities. And all these resources are available on the website of the Faith and Community Initiative. And sorry, there is just one thing I wanted to say. There is also a specific video that encourages mothers and women, again, to act and support their children and men. But again, here, there is no specific focus on the needs of women. So we need to do better on that as well. Here we have some posters that have been prepared for the faith communities on PrEP, on testing, and on treatment. And then here is another activity, which is about migration and HIV. I think we are not doing enough as faith communities on ensuring greater access to services for women in humanitarian challenging situation. There is a very large number, as I was saying before, women who are refugees and migrants, and we are yet not capable to reach them. And so this is a roadmap for faith communities that we have developed in collaboration with 70 faith-based organizations. And we are going to have a consultation on migration and HIV again this year in November, and you're all invited. It's going to take place in Geneva. Here, you all travel there. That's another event that we're organizing. It's a community of faith breakfast, and it's going to take place on the 21st of September in New York. And it's for us an opportunity to bring together the faith community with policy decision makers and political representatives, and also ambassadors or ministers of health. And it's again to make sure that we can foster collaboration between the different stakeholders, and also show again the positive work that has been done by many faith-based organizations around the world. The focus is going to be on pediatric HIV. And let me know, please, if you're interested. I put here other activities and other activities that we are planning and we are working on. And one that for me is very important is the AIDS conference. At the AIDS conference every 2 years, we have, it's the International AIDS Conference. We have an interfaith pre-conference. And it's really a very important moment for us to come together again and share and learn from each other, but also to engage with other groups. And I'm sure that Mike and Ulysses will share the information with you as well. And I wanted to show you the photo on the bottom. The girl with the t-shirt is one of my children. And so as you can see, I just don't say that it's important to make sure that children are informed from a very early age about HIV, and also they are engaged as advocates, but I have done so with my own children. Thank you. And I have last piece, which is here, you can read it, and then I stop. So again, I was reflecting about this concept of femininity, divine femininity, and I thought I just wanted to share with you what I thought. And this came yesterday on the flight from Geneva to here. And so the first point is that without intentional focus on the knowledge about the tools, the policies, the targets, and the commitments, and dedicated resources for closing equity gaps, including prevention, addressing the barriers, making sure that policies are better, and without knowledge around what we should be done to mitigate stigma and discrimination, address violence, we know that women and girls will continue to be disproportionately affected by HIV and AIDS. And faith groups, including the faith initiatives, should urgently and seriously prioritize women. And when I say seriously, it means we really need to come together and reflect better on what can be done and what can be done more together. And then by acknowledging and harnessing the power of the divine feminine within each of us, we can pave the way for addressing HIV stigma and discrimination. The divine feminine represents the nurturing, compassionate, and empathetic qualities that exist within all of us, regardless of our gender. It's about embracing the energies of empathy, of love, and unity that are essential to our collective well-being. And when we celebrate the divine feminine, we honor the strength and resilience within each one of us. And I believe that divine feminine is not limited to women alone. It transcends gender, and if it is a force that unites us all. And so if we want to eliminate HIV stigma and discrimination, we must harness this force to create a more compassionate and inclusive society. And I believe sincerely that together we can create a world where every person, regardless of their HIV status or gender or other status, is treated with dignity and respect.
Thank you, Francesca. Francesca is my international work wife. And so
Don't share about this to everyone.
we have worked together a lot, and we've had a lot of success. And it's always good to have her on this side of the Atlantic to be with us, because oftentimes we have to come over to you. So are there any quick questions before we segue into our last section, our keynote, which all of you have been eagerly waiting on? And my real wife knows about my work wife. So.
But my husband doesn't know about it.
Oops.
That's right.
Oh, he does now.
Right.
Well, I think so now. Thank you, Ulysses.
Just as we have, to a certain extent, adopted getting to zero by 2030. Is there a decade target? I see you have like your campaign 10 million, like it's based on 10 million people not knowing their status and ultimately, obviously, getting them to know it. Do you estimate a quantifiable date, time, decade that you see, at least in this country, if not others that you've been to, where there is a getting to zero date that can realistically be set and reached? And how do you see the faith-based community being a part of that?
So the targets that have been set, and are the targets I was referring to the very beginning, and you see, I think now on the screen, they are set for 2025. Okay, 2025. And yeah, this is just now. And in 2024, no, but the targets are always aspirational. I think that it's very important to have aspirational targets because they push us to do better if we know about them. When we don't know about them, then it's only the governments that sign them that they know, and not always. And so no change can be made. But one of the messages I wanted to make sure to share with everyone is we need to know what are the commitments of our governments. And if we know, we can join forces as faith communities to make sure that we put in place activities, advocacy actions, or policy change intervention that really can support reaching such targets. The targets are not numbers, are people. So we need to make sure that we know them, we are aware of them, and we think about what is needed to get to them. As faith community, working together, but then also joining forces with other groups and other stakeholders. What I really like about this faith initiative is that they've helped bringing faith to the attention of other groups that are not faith, of people that are not people of faith, but they see the value of working with us to reach such targets.